Good morning, good afternoon, everybody. Thank you so much for joining. Thank you for taking the time as you at your busy schedule to join us today. My name is Robert Gabriel, President and CEO of Microwize Technology, and I have a few people going to be helping me today. I have Kim, and I have Yasmin and Justina, so they'll get to do their parts. And just a disclaimer, anything you learn today, you need to verify yourself. Microwize cannot be held responsible for any loss of revenue or data. Today's agenda, we're going to be talking about something that's going to affect all of us, the regulatory changes. So there's something new called the Cures Act. Cures Act, unfortunately, some of the software that you're using today might not be compliant, and you will need to switch to something else. So we're going to go over who's going to be affected, how quickly, what we're going to do to help you move to something that's compliant. Is compliance is important to you or not? So we're going to go through all of that. Without any further ado, I'm going to turn it to Yasmin.
Hello, Robert.
Hi, you want me to just make you the presenter?
Yes, please.
Okay. Now you are the host, Yasmin.
Okay, thank you.
Just another disclaimer is this is being recorded. It's going to be made public. So any question you will be mentioning, we will share it with everybody. Also, if you need to ask a question, you can unmute yourself and speak it up, or you can type it and Kim will help us read the question and answer it for you. All right, without any further ado, here's Yasmin.
Before we get to the final rule of the 21st Century Cures Act, let us just get a very brief idea about what is the Cures Act rule, and in order to know what are the changes that occurred to it. The 21st Century Cures Act, it is an act that started to be in the law in December of 2016. The purpose of it is to make everyone's life that is included in the healthcare system easier, from creating new drugs to getting them verified by the FDA, to getting patients access to their electronic health information, to all the providers that are using EHR systems, to make sure that the EHR systems are easy to use and are not burdensome. So there are some changes that occurred in the Cures Act final rule that concern mostly points 4 and 5 that we see here on the slide, that concern the EHR regulations that it has, and also to affect the terms that are called interoperability and information blocking. So we're gonna get a brief idea about what those are, but they're mainly how the information on the EHR systems are interoperable between providers to get to be shared from one provider to the other, or also to be shared from one provider to the patient, for the patients to get access to all their health information. Okay, so the Cures Act final rules, they were released in March 9 of 2020, and we're discussing them now because a lot of the deadlines are approaching for the changes to be applied. So we wanted everyone to be on track with all the updates. The rules were released by ONC and CMS. They are two big entities that basically released the rule. And it concerns, as we mentioned, information blocking, which is the act of not sharing the information that is on the EHR systems with the parties that are required to get the access. And also, the rule discusses how this access is via something called API. API is mainly the system that connects your EHR with the application that the patient uses in order to access their information. All right, so as you see here in that drawing, the rule aims to make sure that everyone in the healthcare system, as we all do, are making the patient's life easier and making sure that the patient gets the best treatment while being involved in all the process. So let's first check what is the information blocking real quick. Information blocking, as we said, it is the act of not giving access or not exchanging the information with the patients. And this information that is concerned is all the health information that is saved electronically in your EHR. CMS released that there can be penalties that are up to 1 million per violation if you participate in the act of information blocking knowingly and willingly. And because this term is so open-ended, ONC provided 8 categories where it's considered reasonable and necessary to not share the information with the patients. Whereas if you refuse to share the information with the patient, or that you like hinder the process, it would not cause you any trouble or you will not be liable for violations. These are the 8 exceptions that are released in the final rule. I really suggest that you go to the link here to learn more about them, to learn everything in details, because they have a lot of details that you may need to read them through. However, I can get you a brief idea about it here. So they, as we said, there are 8 exceptions. They're divided into 2 groups. The first group relates to the process of fulfilling the request, like when the patient requests to get their information. If you refuse to give them the information due to any of those 5 reasons here, you'll not be considered blocking their information. For example, you think that sharing the information with the patient would result in their harm, so you refuse to share the information with them. This will not be considered information blocking and it will not cause you any trouble. The second group here is related to the procedure of giving patient access to their information. It is released that you can still get a fee, for example, for the information you're sharing for the patient access, because the health IT system you're using may be like making you pay money or you're investing in that system. So it is okay for you to set a certain fee in order for the information to be shared. However, that fee has certain standards that are mentioned here in that link that I highly recommend you check. And also, I gotta tell you that they're not willing to make it very restricted. However, this would be determined on a case-by-case basis. Whereas if you were considered to be sharing in information blocking, you will not get the penalty automatically. However, it would be evaluated on a case-by-case basis. So it is not trying to make it harder for you. However, it is trying to make everything smooth and like accessible by the patients at all times when the time permits. All right, so this is what information blocking is. We've got the other term that is interoperability and patient access. This relates to also the information that is on your HI. What is that? It's to make sure that all the information is easily accessible by the patients as well, but also it can easily be accessed by other providers if you share it with them, and it will not cause you extra trouble to do that. Also, if you decide at any time to transfer from one EHR system to the other, it would be easy and smooth and no loss of information would occur. This is the main purpose of interoperability, and it aims to make sure that errors are as least as possible and the patient gets the best care possible with all the information being there in the system at all times.
So let me stop you for a second, Yasmin, if
Sure.
you don't mind. Okay. So I want to make sure everybody understand that. So the new regulation wants to make sure that physicians are able to switch from one EHR to another, or patient can request their information and get it without any hassle, without have to do data conversion or data export or anything like that. It should be easy to move from one system to another. And because of that, a lot of software are going to go out of business. So let me repeat that. So a lot of software are not going to be able to comply with that rule because it sounds like it's such an easy thing, but it's not an easy thing. To be able to make system are able to move data from one system to another is not easy at all. So a lot of the legacy software, legacy means software that's designed long time ago, are not going to be able to sustain that. So they're not going to be able to be compliant. And because they cannot be compliant, it's your choice to get off them or stay with them. And if it's important to you, you need to get off them and to get it something compliant. We'll talk about the compliance later, but I want you to make sure that you understand how important this is. Sorry to interrupt. Go ahead, Just.
No, of course. Thank you. And then let us just check the updates that have occurred in the interoperability section. The first update that was released is to be applied by December 23 of the year of 2022, this year. So this rule aims to make sure that the healthcare data that is in your system can comply with a new regulation that is set. It is called the USCDI, instead of a data set that was always used that is called CCDS. What does that mean? In the easiest terms possible, it is that the data for the patients you have in your EHR should now include some more information. For example, for the demographics, now it should include the patient address, their email, their phone number, If you see pediatric patients, it should include their vital signs from the height, the weight, the BMI, and so on. All the clinical notes should be shared in the system, and also the author of the data, which is termed under the classification that is provenance, should be also there in the system. If you want to learn more about the data, the USCDI after it became after the CCDS, you can always check the link here after you get the slides in your inbox, and I recommend highly that you check it. And by the date of 31 December this year, the API system that is to be used by you to share the information from your EHR to the patient portal, it has to be upgraded, like the EHR system you're using. It has to be meeting a certain standard that is called HL7 FHIR. So as we were told by EMDS, Medisoft and Lytec will not be meeting this criteria from that during that time and by when that date comes. And it was also told by us by EMDS that we can still get an exception from the information blocking exceptions, and we will not be liable to any penalties if we're not having the API system following these standards. However, you always got to make sure that you share the patient information with them as much as possible in all the forms that are permissible to you, either using the patient portal you're provided or using the printing the data and giving it to the patients when they require it. The third update we've got for interoperability, it relates to the export of the data. So this one, it aims to make sure that the system you're using has like a certain update that allows it to share all the data that is there with just the touch of a button, where you can give the patient all their information and they can access it with a touch of a button, and also to be able to export all the electronic health information to another EHR system with also a touch of a button. So this is also not expected to be there for Medisoft and Lytec by that date, but it was told to us by EMDS that it's still not known what will happen during that time. Maybe they will get an update on that for the programs Medisoft and Lytec. However, it is not confirmed that we're going to have this update available. So this is a summary for all the updates we just discussed. The updates will be occurring, the big updates will be occurring until of the 1st of January of the year 2024. So always keep an eye for all the changes that are occurring and always try to be following up on them. So what does that mean mainly for your practice? What it concerns is majorly the electronic health information in your system being shared to your patients. So we recommend that at all times when possible, you share the patient's information with them, give them access, never try to interrupt the process of them getting their information. You can give them access to the information either through their patient portal, or you can give it to them also by printing the data from your EHR system. So the second chapter we've got is the MACRA, and there are some changes that occurred to the MACRA this year, and there are also some changes that are going to affect people reporting for MACRA in the next year using Medisoft and Lytec that we're going to be discussing. First, let us get a quick glimpse over the change in the scoring for the MACRA. As you know, MACRA is getting harder and harder by the time. And this year, in order to avoid any penalties from your MACRA program, you got to score at least 75 points. This would get you the neutral payment adjustment, which is 0%. If you score less than that, you will be liable to a penalty that may reach up to -9%. So you always got to make sure that you work during the year to get those 75 points at least to avoid any negative adjustment. However, if you can score more than that, you will be eligible to get the positive payment adjustment. And this positive payment adjustment would be applied to you 2 years prior to the year of the performance. So that for the year 2022, the payment adjustment would be applied in the year of 2024. Okay. So what are the MIPS categories? The MIPS categories are the same as always, but there are some slight changes in their scores you got to be aware of. The quality category now for the traditional MIPS pathway is out of 30 points instead of 40. And those extra 10 points move to the cost category. So now the cost is out of 30% instead of 20%. The improvement activities is the same. and promoting interoperability also. However, for the promoting interoperability, there are some changes in reporting the measure itself for this year. And also there are some changes you need to undergo if you're willing to report it in the upcoming year. This is what we're going to be focusing on. So as you know, the promoting interoperability category consists of two parts, the measures, and they have a score out of 100 points, and also the attestations. The attestations, they are assessments that you were asked to do mostly with your IT, and these are not scored. They do not have a score. However, they are mandatory, where if you fail to complete the attestation, you would get 0% for the whole promoting interoperability category. This is how important they are. Okay, so the promoting interoperability category, it is only required to be reported on for 90 consecutive days of the year. You are not required to report on it for the whole year like you do for the quality. However, you got to pick only 90 days to report on it for all the measures, and all the attestations should be applicable during that time. And the last possible time for the year of 2022 is from October 1, 2022 until December 31 of 2022. Same thing would be for the year of 2023. In order to be able to report for the promoting interoperability category, you got to make sure that, number one, as we mentioned, you report everything for the 90 days period, but also you got to make sure that the EHR system you're using is 2015 edition certified and or 2015 edition Cures Act updated. So this is one major update that starting January 1 of 2023, both Medisoft and Lytec are not going to be 2015 edition certified. So if you're willing to report on the promoting interoperability category for the year of 2023, you got to make sure that you transfer to an EHR system that is 2015 edition certified, like Aprima. Aprima is 2015 edition certified. It is easy to use and has everything that you need in order to report on all the MACRA categories that are reportable.
Let me just inject one more thing, Jasmine.
So
when we talk about Medisoft and Lytec not being certified, we're talking about the EHR only. So that's not going to affect your billing. And Aprima is actually owned by the same company as Medisoft and Lytec. So we'll talk about that later. What does that mean when you're doing data conversion to Aprima, if that's what you choose to go to?
Thank you, Robert. So this is the major change that is going to occur for the year of 2023. If you're willing to report on the promoting interoperability category, you got to make sure that all your EHR data is transferred to Aprima, for example, an EHR system that is 2015 edition certified. So the good thing is that promoting interoperability is only required to be reported for 90 days. So you got to make sure that everything is transferred before the date of October 1 of 2023 in order to be able to report on that category. But of course, we always recommend that if you're willing to report on that category, to be ready as soon as possible to avoid anything that could occur during the transfer from one EHR to the other. So if you're willing to be reporting on that category, make sure you do that as fast as possible. Okay. And the next thing we're discussing is just the changes that occurred in the promoting interoperability for the year of 2022. We've got a new attestation that is added. It is called the High Priority Practices Safer Guide Measure. It is a new attestation that you got to complete with your IT people, and you can submit either a yes or a no for some questions that are regarding that measure. And I'm going to tell you that for all the other attestations that are there, it is required from you to submit a yes, not you. If you report a no, this will not get you any score. The promoting interoperability score would be 0. However, for that new measure, you can submit either a yes or a no, and it would still be acceptable. So just make sure to complete the attestation. Okay, these are the measures for the promoting interoperability. There is just 2 things I need to highlight here. That for the third measure, the public health and clinical data exchange, a new subcategory is added, which is the immunization registry reporting. This used to be optional to report on in the previous years. However, this year it is obligatory to report on it unless you can get an exception for it. Also, there are some exceptions available for all the PI category measures, except for the last measure that is provider to patient exchange. This also highlights how important it is for QPP and CMS to get the information shared with the patients at all times. So this measure, its purpose is to make sure that patients get the patient portal and that they can access their information. So in case you submit exception for all the other measures, all the points of the PI category would be moved to that measure. And so this would be the main effective factor for all the category. So you got to make sure that as much as possible, you provide the patient portal to all your patients. They do not have to go through it with it and access the data. However, you got to have provided it to them in order to avoid any trouble and to get the highest score possible. Okay, these are the attestations we mentioned, and they are 4 attestations, security risk analysis measure, same as always. The new one, which is the safer guides measure, and the last 2 attestations are ONC direct review attestation statement, and also the act of limiting interoperability. They're all the same, except for the second one, that is the safer guides. Okay, so if you are eligible to get reweighting of the PI category, you will not be needing to transfer your system to another software that is like a Prima. However, it is not never known if the reweighting options will be available for the next year. These are the options that are available now. So you can get use of them now, but it is not known whether they will be available in the upcoming years or not. And also, I got a note that this is for the people reporting for MIPS. However, if you are part of an APM entity and you're participating in some other quality payment programs that are provided by CMS, you need to check because, for example, for the people participating in APM, it is required for them to have a 2015 edition certified EHR in order to be able to participate in those programs. So you gotta always make sure that the system you're using is applicable with the quality payment program you're reporting to. So what are the options in order to get reweighting of the PI category? There is an option of automatic reweighting, and there is another option for applying for the reweighting manually. The first option, which is automatic reweighting, is for some certain clinician types and also for some certain special statuses. You can check if you belong to any of them here on the list. And I gotta just tell you that newly added this year is the clinical social workers and also the small practices as a special status. And small practices are the practices that consist of less than 15 practitioners. If you remember for the previous years, when you wanted to get an exception and you were a small practice, you had to go to QPP and apply for it. However, starting this year, it is applied automatically to you if you are a small practice or if you have any of the mentioned statuses.
Less than 15 employees or less than 15 physicians?
Physicians, providers.
So it's considered small if you list that, the majority of our practices are less than 15, yes.
Exactly. Yes. And if you also decide to report for the PI after you apply for the reweighting or you get the automatic reweighting done to you, it will still be acceptable. And the reweighting would be canceled. You will get the normal scoring for the category. Okay. So these are also the applications that you can apply for through QPP to get the exception. As you see here, you can create and submit an exception anytime before 8 p.m. Eastern on December 31 of 2022. So we recommend, if you're willing to do a PI exception, to get it done as soon as possible. And if you decide to report afterwards, it would not be a problem. You can still report and the reporting would cancel the reweighting of the category. Okay, so as you see here, there is an option right now available. It is called EHR decertification. So if you have your EHR decertified, you would be able to report on the other parts of the MACRA, and you would get an exception for the PI category. But this is, again, available for this year, 2022. We're not aware of what is going to happen for the year 2023, if it would still be available or not. So we highly recommend, if you're willing to report on the PI category, to get your system transferred as soon as possible to a Prima. Okay, so these are the step-by-step guides that are available on QPP. They're amazing, really easy to follow. check them here and get your application sent as soon as possible for the PI. And also there are some MIPS exceptions for the whole MIPS program that are available for the year 2022. We're gonna go through them. There is an automatic AEC exemption that is available if you are located in a designated region that is affected by extreme and uncontrollable circumstances as defined by CMS. Last year, there was an exemption available that is called COVID exemption. You would get the automatic COVID exemption anyway if you're reporting as an individual. However, this year you got to report for it manually. So if you think COVID affected you or any of the other reasons that are mentioned here affected your practice and caused you to not be able to report on the MIPS as you should, then I highly recommend that you apply for the exception. There is also a guide that is provided by QPP on the QPP website. You can check it here. It has all the steps you need in order to apply for the exception. Also easy to follow, but of course you can at any time contact us and we can get the exceptions on step by step together. All right, these are the updates I got for the MACRA. The final changes and the new act that we are going to discuss is the New Surprises Act. This act had been effective as of January 1 of this year. It affects nearly everyone. This is why we wanted to give you a glimpse of it so that you would be ready for it. And if you're not yet applying it, you would apply it to your practice. So the main purpose of this act is to make sure that patients are protected from the unexpected high medical bills they used to get. The first category of patients that affects are the patients that receive out-of-network services in in-network facilities. So to make it explained in a super easy way, when a patient that is insured goes to, for example, an ER that is an in-network facility, and for example, they get to have a surgery and all the providers participating in the surgery are in-network providers except the anesthesiologist or the radiologist, then the patient afterwards would get a surprise high medical bill and they would be required to pay the difference that is for the provider that is out of network. Starting January 1 of this year, this is forbidden. It is no more acceptable for patients to be paying for the excessive amounts that were applied to them. It is forbidden for the patients that are seeking out-of-network services in in-network facilities to be paying the difference in the bills. So patients are no longer liable for the out-of-network payments they were paying. However, they will only be liable for the in-network payments and costs that they are entitled to. And providers can no longer balance bill patients. So the easiest way to say this is for everyone who's working in hospitals. If you are an out-of-network provider for some insured patients, the payments you will be getting are not gonna be anything but like the in-network cost. And the other category of people that are gonna be affected are people working in practices. This is to all the providers working in practices who get visits from uninsured patients. So from now on, you will be required to provide something called a good faith estimate to your patients. What does that mean? So if a patient is to be provided with a certain service or an item, you will be required to give them an estimate that is called a good faith estimate of how much would that service or item cost before you provide it to them. And also it is required by you to give them the good faith estimate if they ask for it, even if you are not willing to schedule the item or the service anytime soon. We got to tell you that for now, this has to be done by you manually. However, in the near future, it is expected, as told by us by EMDS, that Medisoft, Lytic, and Aprima would have a patient cost estimator to be added in the system. That would make your life easier. It would be to estimate the cost of the service or the items you provide to your patients so that it would make the process smoother. Also, I got a note that starting the year of 2023, it is expected for this rule to also involve insured patients, not just uninsured patients. But for now, it is for the uninsured patients that are receiving care in your practice. Okay, so these are all the updates I got for today. And these are some resources you can visit. I highly recommend you check resources 1 and 2. The Health IT website would get you a lot of insight over the 21st Century Cures Act final rule, all the updates involving it. And the second source, QPP, is a treasure for all the participants of MACRA. You'll find everything involving MACRA in that website, so I highly recommend it. The rest of the resources are some articles that I think are super helpful, and they've helped me get this presentation, so I recommend you to take a look at them. Thank you so much, and I'll move it to Justina now for the Q&A.
Robert, do you want to do some poll questions before we switch over?
Sorry, I was on mute. Thank you so much, Esmond. Great job. We're going to do a quick poll, then I'm going to turn it into Justina. So I'm going to share a few questions with you. So I just wanted to get a feeling of who's on the call. So if you can answer that question, please. And I'm just going to share the results with you. So that's what we have. So the majority are using Medisoft EMR. Then let me see if there's other questions. Yes, there's 4 questions. So the next question is, have you ever attested for meaningful use? That's a yes or no. Okay, so I'm going to end the poll here. And I'm going to just share the results. All right. And to get 2 more questions for you. So the next question is, have you had a patient ask you for digital access to their electronic medical records? Sharing the results. Okay, so look like the majority have not been getting that question. Okay, so the final question is, how do you like your existing EHR or EMR? All right, so I'm going to end the poll here and share the results. Okay. All right, thank you everybody for participating. So I'm going to turn it into, oh, we have a few people that were waiting. I did not see them. All right, so I'm going to turn it into Justina now.
All right, can you guys see my screen?
Yes.
Great. All right, so hi everyone. I'm Justina, the VP of Business Development at Microwize. I just want to spend a few more minutes talking about how all the changes that Yasmin presented on affect your practice in a little more detail, and talk more specifically about how you can prepare. So if you take one thing away from this webinar, it should be that software companies are going to have to make updates for the Cures Act and for MACRA in order to remain certified and compliant. So of the software that Microwize sells and support, we can confirm that Greenway Prime Suite, Practice EHR, and Aprima are going to be certified and compliant with the new regulations. Starting in 2023, Medisoft Clinical, Lytec MD won't be compliant. And I'm sure many of you might be using other electronic medical record systems. So you should go check with your vendor to see what their status of certification is planned to be for the upcoming year. The first step that I would recommend that you do is an audit of all the programs that your practice participates in. There might be contracts that you're in that require you to use certified software, or grants, HIEs, health information exchanges, or ACOs that you work with that state that you must use a certified health record system. So really at a high level, I want to mention a few things that are involved in changing an EMR system. So data conversion is one, and that's moving all of your data from one system to another system. And there's a lot of different ways that we can do that. We can do complete data conversions, partial data conversions, lab interfaces. So when you're changing your EHR system, those will have to be reinstalled or reset up on the new system, training for you and your whole practice, and the closing of your patient accounting system. We don't transfer financials, and most software companies don't transfer any financial information. So that means that for a period of some time, depending on how many open balances you have, you may be working in two systems, closing out your accounts in one system and sending out new super bills from another system. And typically this whole process takes at a minimum 60 to 90 days. So you should plan for that if you are planning to switch to another system. And that can be affected based on the size of your practice, based on the size of your data, how many lab interfaces you have. So keep all of those things in mind. If you do have larger data or larger practices, you're probably going to be on the higher end of that time estimate. So this is a timeline of how you can prepare and recommended go live dates for 2023. As of January 1st, 2023, if you are planning to, or if you are required to report or use an ONC certified system for the whole year of 2023, then you'll need to be live by the 1st. So that means the latest that you should get started with the implementation process is October of 2022. By April 1st of 2023, if you're planning to report for MIPS on the data completeness threshold exclusively with a system like Aprima, then you'll need to be live by April 1st of 2023. If you have any interfaces that you need to be migrated, then we are urging you to be live by July 1st of 2023 so that you have enough time to be comfortable with the system and be ready for that first day of reporting for the last 90-day period of 2023 for the PI category. Implementation timelines will be based on demand and availability of our resources. So we strongly recommend that you start the process as early as possible if you need to be live by a certain date. I will mention with an asterisk that there have been hardship exemptions in the past, which Yasmin talked about a little bit, that do allow you to reweigh the PI category towards the quality category. But like she said, we don't yet know if those exemptions will be available for 2023. So for Medisoft Clinical and Lytec MD users, Microwize is recommending Aprima software, and we do have a special offer for this group. There is no cost for software licenses to you. The data conversion will be done at no cost as well, including the demographics, prescription history, lab history, diagnosis codes, chart notes, attached documents. And the maintenance that you pay right now for the software will be the same maintenance that you would pay for Aprima. So for next steps, check your MACRA and MIPS eligibility and all your other contracts, grants, programs that require you to be on ONC certified software. You can schedule a personal demo or consultation with one of our healthcare technology consultants using the link provided. And Microwize will also be hosting a live demo on July 15th at 12 p.m. Eastern Time, which you can register for from our events page. And we'll also email everyone these links and the slides and a recording of the presentation. If you have any other questions, you can email us at salesteam@microwize.com or call us on the number on the screen. And you can learn more about Aprima as well by visiting microwize.com/Aprima. So that's all that I have today. We can pause now for any questions.
All right, so let's open the floor for Q&A. So either type the question or unmute yourself, and we rather hear the question directly from you.
Hello.
Hi.
Hi. I have a question. So the exemption that was mentioned as for the small practices, less than 15 practitioners, I was a little confused. Is that for the ONC certified EHR, or is that for the MIPS program? I just wasn't clear what that exemption is referring to.
Hey, so let me clear that. So the exception that is available for small practices, it is for the promoting interoperability category for the MACRA. As you know, the MACRA or the MIPS pathway as we're talking, it contains 4 categories: the quality, the promoting interoperability, improvement activities, and the cost. And the exception that is available that you get automatically is for the promoting interoperability category. So if you are a small practice that consists of less than 15 provider, then you will get an automatic reweighting of the promoting interoperability category, and the points for this category would move to the other categories of the MACRA.
So they don't have to be compliant with that category.
Yeah.
Okay.
Okay.
And
Are there-
isn't the interoperability that's what Medisoft clinical Lytec MD not going to be able to do?
Correct.
Okay, and if that makes them exempt, what else is prevent them from achieve MACRA or MIPS for next? So okay, so let me make sure that I understand this. So if I was a small practice, which is very much everybody on this call is less than 15 providers, I don't need to worry about interoperability. But what happens if a patient asks me for my data? Do I have to be compliant with that, or I'm exempt because I'm less than 15 provider practice?
So as we mentioned, this exception is available this year, and it is confirmed that it's available. However, for next year, we're not sure what's going to happen or if this exception is going to be there. So this is why we're recommending that anyone who's willing to report on the promoting interoperability category to be ready just in case that exception is not there. But yeah, in order to report for this category, you gotta make sure that the EHR system you're using is 2015 edition certified, which Medisoft and Lytec are not gonna be. And what that relates to the final rule, it means that the systems will not be compliant with each and every detail regarding the updates for information blocking and interoperability. So, and yeah, and this makes it a requirement for reporting for this category for the MACRA.
Okay, now let me just point out one thing. Usually a Prima is about double the price of Medisoft Clinical or Lytec MG. Now, as I mentioned before, a Prima is owned by the same group as Medisoft and Lytec, so they're making an exception to give you a Prima at the same price that you are paying now with no upfront costs. That's including data conversion, that's including the maintenance, so whatever you're paying for Medisoft maintenance or Lytec maintenance, it will be matched, which is that's almost half the price of what you normally would pay for a Prima if you did not have Medisoft or Lytec. And that was one hurdle that why a lot of many people loved a Prima more than Medisoft and Lytec as an EMR, but they couldn't go to it because of the double the price. So by having it to be a price match, it's a great bargain, and we cannot guarantee that that offer will continue to be. So that offer is there on the table because the company could not meet this compliance, and they doing that exception to match it for you at the price. So that's a great bargain. If this is important to you, I will jump on it. So don't take this lightly, because we cannot guarantee how long this offer will continue to be. All right. So any other questions?
I have another question.
Sure.
So I'm an independent medical biller. I use Medisoft. I bill for 10 different independent practices. Some are actually, they are all single provider practices. Some are very small, say, mental health providers. So am I understanding this new regulation correct, that they need to have a portal so that their patients can view their records with the mental health provider? So I don't use the EMR on Medisoft. Some of these providers don't even have an EMR. They're on paper.
That's a great question. So what Linda's saying here is, okay, so most of my practices are very small. Some of them did not use an EMR. Does that mean if a patient asks them for a copy of their medical record electronically, are they going to be subject to a penalty? And the way that when I'm reading the regulation, that's what it sounds like. Now, from what I understand, the patient has to report that he asked or she asked for medical record from the provider, and the provider was not able to give it to them. So they can technically report them, and they will be subject to penalty. Now, some of the penalties are outrageous. How much they're going to enforce that, I have no idea. So I don't want to say they're going to be subject to a $10,000 penalty or $1 million penalty. I have no idea. So what's the likelihood that a patient will report their own doctor? It can happen, but I'm just not sure how. So a lot of people might get around it with a portal. So the portal, it will allow the patient to log in and get it. But what's going to happen to practice that don't have medical record, to start with? So I don't know. If I know Vida is on the call with us, or Moon. If either one of you know more information about that, or Justina.
I would like to add to that.
Yeah. Okay. Go ahead.
So it says that patients can request the data in the format of their choosing. So you can ask them whether they want it in electronic or paper format.
Okay, but let's say if I'm the patient and I want it electronically.
If the patient says they want it electronically, maybe the provider will be able to use one of the exceptions for the information blocking rule.
Exactly. Yeah.
Mm-hmm. Okay. I was surprised to see that a ransomware is actually one of the exceptions. So there's a benefit now to get ransomware. No, I'm just kidding. Don't get a ransomware, please. Okay. Okay. So I don't think we have all the answers, but those are all great questions that the patient asks for the medical record. What happens if the doctor does not have it electronically, but the patient wants it electronically? What does that mean? So there's a difference between all those years in the last 15 years. I think since 2008, we've been pushed for a physician to get electronic medical record to get a bonus or to avoid penalties. But now we're facing a new era where now the patient needs it electronically, and they can mandate it to be electronically. And what's going to happen if they cannot get it electronically? What's going to happen to that physician, especially if that physician is a few years away from retirement? What's the chance that physician is going to go get an EMR and learn it and be compliant? So I don't see that happening for somebody who's retiring in a few years. Sometimes it helps for a physician that's close to retirement to get an EMR and to be compliant, because it will make it easier for that physician to sell their practice, which is a much better way to sell it than give them everything on paper for the practice. Okay. Right. Thank you. Right. Well, if nobody have any more questions, I want to thank you so much for taking the time out of your busy schedule. Thank you so much for your business. Let me just share my contact information if you want to reach out to me, so everybody sees my screen. So this is my contact information. So if you can't think of any questions now, you can call me or email me. And if no other questions, thank you so much for joining. Have a wonderful day, everybody.